Welcome to MedElite's Integrated Primary Care Program, or IPCP training. This isn't just about documentation, it's our framework for the highest quality care in long-term settings. The IPCP is built on two core pillars. IPCP 1 focuses on our proactive, scheduled care with the 5 key quality measures. IPCP 2 handles acute and high-yielding scenarios with the 7 urgent clinical situations you may encounter daily. Before we dive in, let's cover the core documentation principles that apply to every note. Always use the SOAP note structure. And always remember key documentation points. You must always include the patient's mental state, all vital signs, and for respiratory or cardiovascular issues, the word orthopnea in your review of systems. For a patient with a Foley catheter, document its type, size, insertion date, and the diagnosis for why it was inserted.
Let's start with IPCP 1, our quality measures. These are the 5 key areas where your detailed documentation makes a huge impact. First, antibiotic stewardship. In long-term care, things can move slowly. A urine culture ordered on Monday might sit in the refrigerator for days. This creates a gap in care, and our IPCP is designed to close it. Our goal is to ensure you're documenting everything and getting credit for it. The only IPCP 1 used acutely is when you start an antibiotic based on your clinical judgment for a suspected infection. Your initial note must clearly state this scenario under subjective. Remember, this is a bi-weekly program. Your follow-up note will then document the culture results, the antibiotic's effectiveness, any changes made, and the patient's response. Always include an IDT review in your plan. As a reminder, the IDT review is a structured meeting where you will collaborate with a team of other professionals from different disciplines to create a single, unified care plan for the resident. This process ensures responsible care and accurate documentation, closing that critical gap. Falls and skin injuries are 2 of the biggest risks for our residents. Our IPCPs provide a proactive framework to manage them and protect patients and your documentation.
For a fall assessment, you will see the patient monthly for 6 months. A new fall resets the clock. Your documentation must include a detailed subjective note about the incident, any events that occurred like a hospitalization or send out for a CT scan, and a full medication review for any contributing psych, cardio, or sedative drugs. The most critical step is the orthostatic blood pressure check. When you order this, you must be explicit for the nurses. Write the order detailing the full process, laying flat for 5 minutes, sitting for 5, and then standing. This is a key legal and clinical requirement. Be sure to document 24-hour neurochecks as well. For a skin assessment, you'll focus on pressure injuries weekly. This requires a subjective note, documentation of the Braden or Norton score, and a full wound assessment, including the site, size, color, border, depth, and staging. You'll also order labs like albumin and prealbumin to check for protein-calorie malnutrition.
One final tip, check the dressings. Make sure nurses are dating and signing their changes to ensure proper treatment is being followed. Finally, a quick look at our other 2 IPCP 1s. For a weight variance, you'll see the patient monthly. You'll document the reason for the weight change, check for psychological factors like depression, and order labs like albumin and prealbumin. For advanced care planning, you will document a patient's wishes for their future care, but only if their BIMS score is 13 or higher. If it's below 13, the discussion must be with a family representative. In summary, let's cover the standard cadence for our core IPCP 1 programs. Starting with our most frequent, skin assessments are conducted weekly. Our antibiotic stewardship program is reviewed every 2 weeks. On a monthly basis, you'll track both weight variance and fall assessments. For falls, this assessment continues for 6 months, and a new fall resets that 6-month clock. And finally, advanced care planning is reviewed with residents quarterly.
Now, for IPCP2, the acute, high-impact situations you handle daily. These are the core 7 we focus on. You must capture these notes, especially when a facility calls you for a specific need. Common scenarios like shortness of breath, acute behaviors, and insulin order changes require a detailed note on why you are intervening. Always remember to check for contributing mental health issues and document them. Other critical interventions include new onset isolation, downgraded diets, and nebulizer orders. These must be documented with a clear rationale and a plan for how you are addressing the issue. Finally, the most critical IPCP2 scenarios: IV fluids and IV antibiotics. This is where your advocacy is key. If you believe a patient requires intravenous therapy to prevent a hospitalization, you must first document your clinical recommendation. However, if the facility cannot fulfill your order due to a lack of equipment or staff, you must clearly document this in your note. This shifts the accountability from you, the provider, to the facility. Your orders are a clinical priority and the facility must support them for you to do your job. These IPCPs are the MedElite way. Check the IPCP Provider Reference Guide for detailed SOAP note instructions on each subject.